In honor of Breast Cancer Awareness Month, local Sutter Health breast cancer experts took part in a Zoom call, and during the call, they talked about dense breast tissue and advances in detecting and treating cancer. During Breast Cancer Awareness Month, doctors are raising awareness about dense breast tissue, too.
Women with dense breast tissue benefit from additional whole breast ultrasound.
They say breast density is not like a lump you feel. It refers to the amount of breast tissue in relation to fat.
Breast tissue is dense mammographically. It makes it more difficult to detect breast cancer. Ultrasound helps us look beyond that.
Dense tissue doesn't mean you skip a mammogram in favor of an ultrasound.
But there's a lot of stuff that we can't see on ultrasound, including microcalcifications, which often are the earliest sign of a breast cancer. So it really is mammography / tomosynthesis is really the gold standard for breast cancer screening.
Thanks to breast density legislation, mammogram results will let patients know if they have dense breast tissue.
It makes sense to have those two exams concurrently. I'd much rather see them, around the same time rather than, several months apart, for example.
Prior biopsies help create a risk calculator.
If one has had a prior biopsy that shows atypia, so atypical cells, and that's something that the pathologist sees under a microscope, we often recommend high-risk screening breast MRI in addition to mammography. And preferably performed at the same time.
There is a high-risk breast clinic at the Ridley Tree Cancer Center, and there are advances leading to excellent outcomes.
An explosion of new drugs and new treatment modalities and really precision medicines.
There are surgical advances too.
The skin and nipple sparing mastectomies with preservation of sensation to the nipple with what we call neurotization or reinnervation of the nerve endings behind the nipple. So that's something that some of the centers do.
Surgery may sample lymph nodes if cancer has moved.
And we want to do the best cutting edge job that we can do for our community so that women don't have to travel far for their breast cancer care.